I guess if the patients are not in the terminal stage, even though they are on treatment, if they are at an earlier stage, then that there is potentially a remission period for the patient, whichever treatment they are having at that time, then yeah, it will make a lot more sense in some ways to encourage the patient to quit. I generally don't hear from the oncology team whether or not the patient is in a good space in terms of their survival, their prognosis. I usually hear it from the patient. So
Right.
I can only gauge it from their side. You can usually tell. I mean, I haven't seen a lung cancer patient who has a good prognosis. That they're always usually quite sort of late in the diagnosis. They're never really early where you can just take it out and they can live, for years and years after that. Most of mine usually die within a few months of them, having the diagnosis. So in the short time period, quick smoke is really not, I don't think anyway, is it even a feasible option? Well, that's probably not the right way of saying it. Is it a priority? Well, I don't think so. Not in a few months of life that they have left. I'll expect someone to say to the patient, "Hey, look, you should quit. You've got lung cancer or some sort of cancer that we know can be attributed to smoking. Maybe you should quit smoking." So I don't think that would be a too hard basket to talk about at that stage. Yeah, I guess if it's not just a old generic quick smoke pamphlet that is related to cancer, then yeah, it would. Yeah, if you state all the different types of cancer on it, it probably make even more impact. Yeah, than just the usual advertisement on TV. Your lungs will rot. The pictures of your lungs rotting.
If there can be a system whereby the letters can come out to GPs swiftly, it's extremely beneficial for us. And it's all about, I think in general practice, it's all about holistic care. So we need to know what treatment the patient is on, duration of treatment, and I guess most importantly, what are some of the potential side effects to look out for, with a cancer treatment that the patient is having. Because the duration of treatment and the side effects, that has an impact on the patient physically, but also psychologically. And psychologically, they need to be ready to cease smoking or at least reduce the amount of tobacco use that they're having. And so I guess having a correspondence letter that talks about the medications the patient's on, what side effects are we expecting with this particular patient, morbidity, prognosis, all that contributes to, I guess, the holistic assessment of the patient. And that then helps us. We know what the patient's going through. We know what potential side effects to look out for. And we therefore know, the potential issues that a patient might have with initiating pharmacotherapy for smoking cessation. So if they're getting a lot of side effects already with the treatment, and Champix, for example, has more side effects, it's good to know, what their baseline is in terms of their cancer treatment, so that we're aware and can empathise what they're going through, and then counsel accordingly with another potential medication that they're going to take. Side effects as well of the treatment, interactions is pretty important. So, as GPs, obviously we don't deal with any of the oncology drugs on a regular basis. So, awareness of potential interactions is important for us. In a nutshell, handouts are useful. Patients aren't the most reliable in terms of bringing information back to us because of various factors, as I've mentioned. The email system's pretty suboptimal. Faxes generally work, dinosaur technology, but all we need is something very general, something simple, just with a patient's name on there, attention to the GP. That will be useful. Depending on the practice, how everything works. I mean, my practice is generally pretty efficient at getting correspondence scanned in. Doctor sees the correspondence, doctor ticks it off and gets scanned into the file. So that hopefully when the patient sees the GP, all the information's there.
Having specific information about how smoking relates to that specific cancer is helpful. So I'm not an expert on which cancers are more likely, or what's the probability loading that smoking puts on each cancer. Um, a decision tool or some information to support to say, okay, well, if you reduce smoking by X percentage or X number of cigarettes a day, it will reduce the likelihood, or increase your life by this many days, or something. Something that kind of puts it in a tangible way would be handy. That would be handy. So you can, that way you can develop targets. Like even if they don't fully quit, you could say, well, if you're smoking 20 a day and you cut that down to 10 a day, that might add another year to your life or something like that. Like you can sort of add a tangible number that people can hold on to. Yeah. So one is the loading of how smoking affects their specific illness, but also it would be useful to know whether the oncology services themselves provide any specific smoking cessation support. Also, it would be useful to know whether the oncology services themselves provide any specific smoking cessation support. I'm a strong believer that if somebody is ready to quit, you just hit them with everything and try and support them. I mean, I can provide all the different pharmacotherapy supports. That's very easy. And there are some various different psychological supports that we can use, that we can employ. Some of them are more or less helpful than others. But sometimes within the public hospital systems, there are some really good like smoking psychologists, or even smoking therapists. But even if you had some way that if you had a label of cancer, that would allow you to be fast tracked into one of those specific clinics where you have somebody who's quite nuanced at providing specialist advice. If somebody was ready to go, not for everybody, but just as an option, that'd be handy. Like often we get a summary of the multidisciplinary meeting, and then you could have tacked onto the bottom of that, if patient X is interested in quitting smoking, we note that they're a smoker. If they're interested in quitting smoking, this letter can serve as a referral to our specialist smoking cessation service run by blah. I don't know, something like that. Be handy, but I don't know if such services exist.
Over the years, there's been either no mention of it at all, including with people with lung cancer, to the teams being very proactive in moving forward to set up some sort of plan. Now, I don't. It may well be that the documentation wasn't there, and they had discussed it. I do the same things. I'll discuss a lot of things, and I sometimes fail to document. In fact, I often fail to document half of what I discuss. So it's quite possible that those discussions were had. And when I tend to ask, you usually know whether or not it's been mentioned or not. So in terms of what information, I suppose, again, I think correspondence and communication should, in my mind, should be really simplified. It should be like, we've discussed smoking cessation and have advised this, or we've discussed smoking cessation and advised them to talk to the GP about it. I think whichever way is fine, as long as if it's been a point of conversation, then really just in simple dot form saying what they expect of the GP. So sometimes they want the GP to be the primary person. It's sometimes we are support person in it. Again, I think if it's been reviewed with the oncologists, then in their correspondence, just document it and state it. This is what we're doing, or this is what we want the GP to support us with, or want the GP to take over the management of. I mean, GPs are very, that's what we do. We care coordinate as much as anything else and manage a lot of chronic disease. So, I think sometimes there's a lot of other comorbid conditions in a cancer patient that we're also managing. And certainly once you've been a GP for a while, you find most patients have got a couple of chronic conditions you're monitoring and managing as part of what you do as a GP. So I think anything that helps simplify that and gets to point, whether it's please do this or refer to this service. I'm actually quite okay. I quite like it when specialists say specifically what they want, because I think it's very helpful. It's as much educational as anything else, because things change over time.